This is a CJASN podcast, and I'm Anamika Adwaney, a nephrology research fellow at Imperial College London.
And I am Damien Ashby, a nephrologist and senior author on this study.
We are happy to present a summary of our manuscript entitled Central Venous Stenosis, Access Outcome and Survival in Patients Undergoing Maintenance Hemodialysis, which has been recently published in CJASN. Fistula formation is desirable, but can be hard to achieve in older and comorbid patients. As a result, catheters are sometimes an acceptable alternative. However, a complication of concern is central venous stenosis, especially as it is unclear which patients are most at risk. To better understand the consequences and risk factors for central venous stenosis, we performed 2 retrospective studies from the same cohort. Our cohort included 2,811 patients starting hemodialysis over an 8-year period in a single centre. In the main cohort study, we identified 120, or around 5% of patients who developed central venous stenosis at an average of 2.9 years after starting hemodialysis. The majority of cases were asymptomatic, but minor symptoms and occasionally severe features were also seen. When comparing survival, however, we found no difference between those with central venous stenosis and an unaffected matched group from the same cohort, though we did find that affected patients required more interventions to maintain vascular access. A diagnosis of central venous stenosis therefore clearly impairs future access, but does not seem to markedly affect patient survival.
In the sub-study, we randomly selected from the cohort a subset of 500 patients, all with a history of catheter use. Within this group, 34, or around 7% of patients with central venous stenosis were identified. Patients were more likely to develop central venous stenosis if they had a greater number of previous catheters, a longer catheter duration history, or a pacemaker. Interestingly, there was a strong relationship between age at dialysis initiation and the development of central venous stenosis, with older age associated with lower risk. This highlights the importance of catheter avoidance in young hemodialysis patients, but also supports the selective use of catheters as permanent access in elderly patients.
This study further delineates our understanding of the causes and consequences of central venous stenosis and suggests a more favourable role for catheter access in elderly patients.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast of the American Society of Nephrology.